the economic inequalities, but
Yeah.
also some of the racial biases
Yeah.
within the medical
Absolutely.
field.
Yeah.
And one in particular, which recently was a really sad story about a YouTuber. I'm not sure if you follow the
yeah.
story. It was a Nicole Thea, her
Yeah.
name was. And there was the issue in regards to her pregnancy.
Yeah.
And she had some level of difficulties, which then led to her having a heart attack
Yeah.
and passing away. And now, what is your take on it? Because obviously you're a doctor, so you have more idea. As in regards to how black pregnant women are perceived within the medical sphere.
I think there's a lot of implicit bias in healthcare. So when you look at it, black women in the UK are, I think, 5 times more likely to die in childbirth compared to white women. And again, it's a few things. So the things that kill pregnant women is heart disease and strokes. So if we take it back to what I said earlier, just by being black, you're more susceptible to heart disease and strokes. One, because of the hypertension, high blood pressure, and 2, the obesity and food choices. And that again boils down to an economical thing. So that's one side of it. And the second side of it is this implicit bias that healthcare professionals don't really know that they have. So black women's pains, black women's concerns aren't taken as seriously. There are papers and textbooks from 2017. I remember seeing a textbook from 2017, this is just 3 years ago, that quoted that black people feel pain differently from white people.
Oh, wow.
So things like this create a bias.
Is this still being read in the...
Yes, this is the textbook from 2017.
Oh, wow.
That I saw, I think, a few weeks ago, that black people feel pain differently, black people don't perceive pain differently. So, or black people are more aggressive. So if a black woman is asking for help in hospital that she's in pain, it can come across as aggression and not being taken seriously.
So stereotypes.
Yeah, so it's a stereotype thing. It's a bias thing that needs to be addressed. So a few NHS trusts are starting to do that, workshops and implicit bias and recognizing your own bias as a healthcare professional. But it's something that exists.
Yeah, but the thing is that, to me, what I find ridiculous is that these sort of textbooks, they need to be identified, pointed out, and then rectified or completely gotten rid of. So why are they still in circulation when we know that there might not be no necessarily inherent differences between 2 different women feeling pain?
They're in circulation because people produce stupid research all the time.
Yeah.
So some researcher has decided that they were going to see how black people feel pain compared to how white people feel pain. And they were going to do that by a questionnaire. And they then put it in a textbook because it's science and it's correct. Yeah. And that's how these things still come about.
Yeah. Questionnaire researchers to me are the worst things ever because culturally everyone's different. The way we react to stuff is different.
Yeah.
Like the way we communicate within the African community is different. Because I had an uncle who used to tell me a story about working in a... Is a mental home the right term? That
okay,
yeah. So he used to work in a mental health home, and he said that sometimes, like when there was a black person eating with their hands, for instance, they would take that as them acting out their mental issues. Yeah. When in fact it's a cultural thing. Yeah. Because that's what we do at home. That's how we consume certain foods within our nations. So is that lack of understanding? Like, is there processes in place to rectify these biases and lack of understanding?
There aren't processes yet, but I think it's starting to happen, but it's a lack of understanding. And sometimes, if you have, let's say you have a white male consultant and you have a black pregnant female in labor who's saying she's in pain, that consultant doesn't completely identify with that woman. Like you might think, oh, she's just making it up, or she's not in that much pain. I've seen worse. And
so disconnect.
There's a complete disconnect, and that's the thing. That's the implicit bias, and that's the thing that you have to know that you're capable of doing. Unless you know that this is something that you could do, you're never going to address it. Yeah. And that's what a lot of hospitals are starting to put in place, especially since COVID, is bias training and understanding and recognizing the biases that you may not even know that you have. Yeah. But unless you know that you have something or you're doing something, you can never rectify it. So
is the representation enough though to rectify the issue? So right now, I don't know. Maybe I'm just seeing a lot of nurses of ethnic backgrounds, but maybe the people at the top end who get to deal with patients directly. What's their representation like in order for?
It's not where it needs to be. So I think at the moment, black doctors make up about 3%.
So that's disproportionate to the population.
Level. Very disproportionate to the population. So black and ethnic minority consultants are about 3%. And then black and ethnic minority consultants are less likely to get what we call a substantive post in the NHS. So as a consultant, if you are substantive, you are then free to go do things like private work and private clinics.